Okay, now I've got it together. So we left off, we were starting to talk about vocabulary associated with the respiratory system. And I was trying to impress upon you what that vocabulary actually means. Surface tension we covered. Make sure and turn my phone off. Surface tension is just the tension you have with a thin film of water that you have lining your alveolar sacs. And the benefit is it aids gas exchange, but the detriment is that when you exhale, those sacs want to collapse upon one another, and then that could lead to a collapsed lung. But then what breaks up? It's not on there, so I could ask it. What breaks up that surface tension in your alveolar sacs so they don't collapse every time you exhale? Surfactant. Okay, we certainly talked a lot about that last time. Okay, so the next vocabulary term is compliance. And compliance is simply the ability of your lungs to stretch when you inhale. All right, so the lung tissue is supposed to be stretchy and flexible so that when you take air in, it expands. I'm going to show some videos. I think I'll get to it today, which really demonstrate that really well. When the lungs are damaged, and we'll talk about damage to the lungs and common illnesses and diseases, that compliance, so when you inhale, your lungs comply, they go, so this is compliance. And then when you exhale, they recoil and they go back to their normal shape. So literally compliance, recoil, compliance, recoil, every time you breathe in and exhale out. So recoil is simply them going back to the normal shape. It's also known as elasticity, but I don't call it that because it makes it confusing with the stretchiness of your lungs when you inhale. So I just call it recoil because that means going back to shape. So with this, let's see, I can't remember if this GIF actually, there it does. All right. So compliance, then recoil, compliance, then recoil. So we're going to talk a lot more about damage to the lungs. I certainly talked about COVID, but anything that damages the lung, and especially something that's chronic, it goes on for a long period of time. Your body, anytime a tissue is repeatedly inflamed, will end up putting down scar tissue. That tissue becomes fibrous because it's fibrocytes that lay down the scar tissue. Anyway, once a tissue forms scar tissue, it's never going to be the same. It's not going to be elastic anymore. It's going to be stiff and rigid and can't do its original function. So when that happens to your lungs themselves, imagine your lungs not being compliant because they've got scar tissue. It's called pulmonary fibrosis. And that's permanent lung damage. You're not coming back from that. So once scar tissue's there, it's permanent. Imagine trying to breathe with a belt wrapped around your chest really tight, and you're trying to breathe against that resistance, against that scar tissue. It's very hard to ventilate. That's why people who have permanent lung damage, for whatever reason, are walking around with the portable oxygen machines and, in the nose and everything like that, is because their lungs aren't functioning like they should be functioning. So they need supplemental oxygen. Okay, so lung compliance, things that increase compliance. Surfactants, of course. Surfactants do it by, let's see if my pen's going here. Well, that was weird. It's trying to enlarge. They increase compliance, and I'll change it to another color. I hate that. Increase compliance by decreasing surface tension. All right, let me turn this around so I can write easier. Okay, now a disorder, emphysema. You've heard of emphysema? Yes, it's common. Usually you see it in people who've been chronic smokers, and this doesn't happen like you smoke for a year or so, unless you're smoking like 3 packs a day for a year or so. But this takes a long period of time for this kind of permanent damage. And I'm going to talk about it more, but emphysema actually increases compliance in a bad way by, I'll say, destroying alveolar walls and trapping air. And I talk about this in another slide. It's known as an air trapping disorder. So all those alveolar sacs have a thin 1 cell layer thick wall, the grape cluster, right? So all the little grapes are separate from all the other grapes by a membrane, a cell membrane. With the chronic problem that happens with emphysema and what happens with chronic smoking for a long period of time is you're taking all those particles that are in cigarettes or cigars or whatever, and they're foreign particles. And sometimes they have nasty stuff in cigarettes that's supposed to increase nicotine absorption, but basically they're foreign particles. If you inhale foreign particles into your lungs, they settle into the bottom of your alveolar sacs by gravity, and they're never coming out. That's it. They're in there. Your body can try and break down or phagocytize particles and destroy them. But really, if you keep on doing that activity, you keep not ingesting, but inhaling those particles, they're never coming out. All right. And that acts as a foreign body. And that causes irritation because your body knows it's a foreign body. You get a low-level chronic immune response. And after a while, that inflammatory response wears away the walls of the alveolar sacs. Much like people who have arthritis, you have irritation, inflammation in your joints. And if that is not treated and it goes on and on and on, that chronic inflammation wears away the cartilage around your joints. All right. So chronic inflammation, bad. Okay. But that increases compliance because what happens with emphysema is the alveolar sacs will expand with air. But since some of the sacs are missing their walls, when you exhale, they can't close completely because they're missing their wall. So some air stays trapped. And what happens is if there's some air that's trapped in your alveolar sacs, it stays there. It's like dead space. That's like low oxygen air. All right. Because when you exhale, the alveolar sacs are supposed to exhale all the air that was in them and the CO2 they contain. So when they can't get rid of all that air and some CO2 remains, the next breath you take in less oxygen because the sac has some remaining air, dead space in it. And so you're not getting as much oxygen with every breath that you take. And so that's why people with emphysema are taking the supplemental oxygen tanks with them, is because they need a higher percentage of oxygen delivered to their lungs than what's in atmospheric air. Okay. So emphysema looks like this. And I say smoking. Well, we're coming to find out now, there's been vaping going on for long enough that that's not necessarily the safest thing people would think it is. So the particles settle into your alveolar sacs and they don't come out, especially if you keep inhaling that substance. And the chronic inflammation leads to wearing away of the walls. I mean, there should be a wall here and here. All right. Normal healthy alveoli have an intact cell membrane, and so they can expand, contract, expand, contract. Well, these sacs can expand, but they can't evacuate all the air that was left in them from the previous ventilatory cycle. And so really, you're on low oxygen all the time because you can't get rid of the dead space. And so not good, permanent damage. Once those walls are gone, they're gone. All right. Okay, so that's why it's called an air trapping disease, is because you can't get rid of all the air that was in the sac. So vaping, I don't know if any of you vape or smoke, but it's been going on long enough now that researchers have been looking at it. And one of the things they looked at is protease enzymes. Protease, it ends in ASE, so it's an enzyme. The protein is for protein. So it's an enzyme that breaks down protein. Guess what your cell membranes are made of? And not just lipids, but proteins. And so they found people who vape had levels of protease similar to those who smoke cigarettes. All right. It's still foreign material, and your body's responding with an inflammatory process. So this actually takes you to an actual publication if you're interested. I'm not going to open it up here, but I'm not just making stuff up. I actually looked it up in a published journal. So not as safe as we thought it was. Okay, getting back to lung compliance. So here's things that decrease compliance. And remember, if it decreases compliance, it's like wrapping a tight band around your chest. Your lungs can't fully inflate. That's what decreasing compliance does. So common conditions, anything that can cause chronic inflammation and lead to scar tissue of the lungs can decrease compliance. Now, asthma decreases compliance because it is inflammation of your airways, your bronchioles, due to a histamine reaction to something. All right, people have asthma. It can be exacerbated by, I know my husband, when we were in graduate school, we just lived in the cheapest housing possible, which is apartments. And they don't clean them that great before, after the previous tenants left. And this one had carpeting, which is great, right? Carpeting is so nice. But it traps all kinds of dander, pet dander, people dander, all kinds of things. And even if you vacuum, you're not getting all of it. And that really got his asthma going. And he wasn't being treated perfectly by his healthcare provider because we had no insurance. But anyway, whatever triggers asthma, what's happening is your bronchioles are becoming inflamed, the tissue inside, and that functionally narrows them because the inflammation makes less air able to pass through. And so that's what's happening with the decreased compliance. Less air is getting through. So when you have an asthma attack, you can't really expand your lungs very much because the airways are narrowing. By the way, what is one of the drugs we covered that is a beta-2 agonist that can open up the airways in an asthmatic patient that's having an asthmatic crisis? It's the rescue inhaler, albuterol. Okay. But you can't abuse it, because if you abuse it and use it too frequently without taking the inflammation down, your body becomes tolerant to it. But anyway, bronchitis, that's inflammation of your bronchioles. It's a little different from asthma. It's the same thing, but in this case, it's not classified as asthma. Inflammation of the bronchioles. This can happen one or two times. Someone's exposed to something that irritates their bronchioles, and the same thing happens, they narrow. I used to get this when I lived in upstate New York, when it got really, really cold out. I mean, we're talking cold, like -20, okay? That air that's so cold definitely irritates your airways because it's so cold, and that your alveolar sacs are only one cell layer thick. And when you breathe in that kind of air, it can actually damage them. So you're supposed to wear a scarf or a mask there. But I had chronic bronchitis until I got better about making sure to cover my mouth and nose when I was out in cold air. Pulmonary fibrosis is permanent lung damage. It's when the lungs become scarred. Due to a chronic inflammation event. So there's a lot of overlap here. Bless you. So if your lungs are chronically inflamed from smoking, vaping, chronic bronchitis, you're breathing in cold stuff that damages your alveolar sacs, or asthma that's not being treated sufficiently, and many other things, COVID, okay? The body responds to chronic inflammation by laying down scar tissue, and once the scar tissue is there, the lungs are permanently damaged. And you're not going to have compliance because the lungs become stiff and inflexible. Bronchoconstriction, you know what that is that is decreased diameter of your airways, of the bronchioles. Which all of these things, well, actually asthma, bronchitis, that's what's going on. In asthma and bronchitis, your bronchioles are narrowed, not because the muscle's contracting, because inflammation is causing swelling. So getting back to asthma, chronic bronchitis, you have to treat the patient with anti-inflammatories to bring down the inflammation. A rescue inhaler is good. It gets a person out of an asthmatic crisis so that they can breathe. But if you don't treat the inflammation, you're eventually going to have scar tissue. And so people have asthma, chronic bronchitis, they need to be on anti-inflammatories to stop the inflammation so that this doesn't happen. Okay, so it's a two-pronged approach with these respiratory disorders. Okay, so more lung pictures. So pulmonary fibrosis. So here's a pretty good lung field, nice and black, which it should be, which is air. And this actually, it's scar tissue. It could actually be a mass. All right, but that's what it would look like if you saw scar tissue or a mass in the lungs, that's what it's going to look like. Obviously very abnormal. If someone has this and you've got a mass of tissue, it could be benign, like fibrosis, but you have to, if you saw this as a nurse on an x-ray, you'd be like, we need to do a biopsy of that because it could be cancer. All right. So if someone comes in and that's showing on their x-ray, they're going to be getting a biopsy, send it off to pathology. Is it benign? Is it just scar tissue? That's a problem too. Or is it precancerous? Is it full-blown cancer? So obviously abnormal. Okay, here's a video that if you know someone who smokes, show this to them. It might change their minds. But pulmonary fibrosis. So here we have a nice set of lungs over here. This is what they should look like. They've got attached to an endotracheal tube and an ambu bag to push air in. And when they push air in, you should see the lungs be compliant and then recoil, compliant, recoil. Versus these lungs, which were obviously removed from the person, but that they did not like put charcoal on those lungs. That's actually what a person who died probably from emphysema, I don't know, but that black tissue, that's real. Okay. And you're going to see the lack of compliance from this. So I hope the video is still up. I hope the link's still working. Good. No, I don't want your trial. Give me the full screen. There we go. Okay. So obviously if they have the good healthy lung here, they're going to. So compliance, recoil. Compliance, recoil. Compliance, recoil. That's what they should do. Smoker lungs. Not good compliance. All right. This one's hardly expanding at all. I think we know what the patient died of. All right. Yeah. Well, anyway, I saw that and I was like, ew. Okay. That's bad compliance. That's your lungs aren't functioning at that point anymore. You can't get air in. So, okay. How are we doing on time? Good. All right, so we've covered a lot up until this point. So now let's actually talk about some common disorders. I've already talked about asthma, bronchitis, emphysema. We'll come back to those, but we'll talk about COPD, chronic. Well, actually, what does it stand for? Some of you might know. It's an acronym. It stands for chronic obstructive pulmonary disease. So it's in it. It's pulmonary disease. It's obstructive in its category and it's chronic. It goes on for a long period of time. So disorders, I wish we could do the respiratory lab, but we haven't been able to since COVID. It was really cool. We have respiratory spirometers that you can breathe in into, and it can measure your lung volume. And you can, this is a common thing that's done in a hospital or a clinic if someone has asthma or any of these respiratory disorders to determine, is it a restrictive disorder? Is it an obstructive? How bad are the lungs? You can actually measure normal lung volumes for people, and it's different between men and women based on body size, but COVID screwed that up. But anyway, a restrictive disorder is lung tissue has been damaged, often permanently. And so lungs are stiff or the respiratory muscles are weak. I didn't get into that. There are respiratory problems that involve respiratory muscles, things like things we covered, myasthenia gravis. The muscles are weak because the immune system is attacking acetylcholine receptors on smooth muscle, cardiac muscle, skeletal muscle. There's also amyotrophic lateral sclerosis we covered in the muscle chapter, where the neurons that stimulate muscles are damaged. So that can lead to weak muscles. People who have ALS eventually succumb, that moves in from their extremities. Eventually they can't breathe anymore. All right, so that's restrictive. So pulmonary fibrosis fits that perfectly because pulmonary fibrosis is scarred lung tissue. Obstructive is the lung tissue is normal for now, but there is increased resistance to airflow getting into the lungs. So the airways are narrowed. So perfect example, asthma, because the airways are narrowed because of the inflammation going on. Not shown here, but chronic bronchitis would come under this. COPD, which has obstructive in the name. And then cystic fibrosis. Anyone know what that is? It's common enough that I include it. I knew one person in my high school that had it. You're born with it. It's a congenital thing. It's a homozygous recessive condition where you have an abnormal chloride ion channel on your alveolar sacs. That sounds innocuous, right? Sounds, who cares? But your alveolar sacs are supposed to have or produce or allow a thin film of water to form inside them to increase gas exchange. So in order to move water, you have to move salt, sodium and chloride. And what happens in cystic fibrosis is because of the abnormal chloride ion channel, that thin film of water becomes thick, gooey mucus. And that becomes the problem that they have with getting air into their sacs. Okay, so let's talk about the first one back here, restrictive. Okay, pulmonary fibrosis is a real thing. Obviously, smoking, I'll start from the bottom up. Smoking is you inhale foreign particles from cigarettes or cigars. I'll just say cigarettes. And they causes chronic inflammation over time. This takes a while, which leads to scar tissue. I'll just say, scar tissue. And that's the permanent damage. Okay, that would show up on an x-ray as all these white particles, little bits of fibrous tissue. All these things above cause the same problem, scar tissue over time. So silicosis is inhaling fine particles of glass, sand, or stone, dust, which leads to, all these lead to pulmonary fibrosis. So Dr. Parr, he's such a good topic for so many physiology things I teach because he gets into so much mischief. Thank God he has me. So he took up flint knapping, which is basically it's a Native American thing where you take a percussive stone or tool and you chip away at stone that's flint knappable. It can, when you hit it, percuss it, shards of that stone break off. And you could do that successfully and make an arrow point. So he took this up as a hobby for whatever reason, because he was always interested. He loved finding arrowhead artifacts. And then he said, well, why don't I try and make them? So he starts in his little work shed and he gets all these stones and he tries breaking them and he's learning and he's flinging off particles of stone and shards and slabs of stone. And I know that in doing that, you can't see it, but there's fine particles of stone dust being aerosolized. And he's in this closed in shed working. And I'm like, you don't want silicosis. You can't see it, but there's fine particles of stone that you're breaking off and aerosolizing in the air. I said, open the shed, have a fan running across your face. So it's pushing away all that stone dust and you're not breathing in it. And I'm glad it did, because that became a hobby for about 3 or 4 years. Plenty of time for silicosis to set in. All right. If someone does sandblasting for a career, they should be wearing a respirator that filters out that. Same thing with glass. If you work with glass, or I'll get later, fiberglass, you should be wearing a mask. Even if you're mowing the lawn, especially you see people mowing the lawn and there's a little bit of dirt and they're flinging up all that dirt and that cloud of dust around them, you should be wearing a mask if you're going to do that, because you breathe that stuff in. It's not going anywhere. It's trapped in there. And that causes the chronic inflammation that leads to the scar tissue. So anthracosis is black lung disease or miner's disease. It's breathing in, inhaling coal dust. I don't want that. And that killed many miners, still does. They're still mining today. Okay, they go down, deep tunnel, under the ground, not much ventilation there. They should be wearing masks. I bet a lot of them don't or didn't. And over time, that coal dust causes the chronic inflammation that leads to the scar tissue. Oh, by the way, scar tissue, things that are being chronically inflamed and form scar tissue. And there's still inflammation going on. Did you know that that scar tissue is prone to cancer? It's true. Okay. Anything that's people who have eczema and other disorders where they have chronic inflammation of their skin and they're taking treatments for it, hopefully, That chronic inflammation, you got to be careful because that tissue is prone to cancer. What happens is your body's trying to repair cells by mitosis. It's replacing cells. And it has to do it over and over and over and over again. Eventually, there could be a mistake in mitosis, which is known as cancer, which is mitosis out of control. So things that are chronically inflamed and that form scar tissue are prone to becoming cancerous. Not saying it will, but there's an increased risk of that. Mesothelioma, anyone know what that is? There used to be a lot of commercials on TV for this guy named Doug who has mesothelioma. Basically, that's inhaling fiberglass insulation. Okay. It's got fibers in it and glass. It's a good insulator, but if you inhale that fiberglass dust, it's not going anywhere and it causes the chronic inflammation that can lead to lung cancer. In McNair, okay, we're in McNair, in all the floors, there's fiberglass insulation. When they were doing some updates to Leatherman, you probably weren't here when they're doing that, it was a number of years back. They did most of the work in Leatherman because there's no fiberglass insulation there because that side of the building is new work. They don't do much work. And if they do work in McNair, they come in with the hazmat suits and they put long plastic things down in the hallway. And it's a whole shebang because you don't want to disturb that fiberglass insulation and release it and have it into the air. Kind of scary, right? Make sure if you live in an old home, is there fiberglass insulation? Ooh, okay. But yes, all these things lead to pulmonary fibrosis, which could lead to lung cancer. So it makes you think a little bit more, right? Okay, moving right along. Asthma. You're going to see it. Some of you might have asthma. The bronchial smooth muscles. I'll say smooth. Oops, nope, go back. Come on, pen. The smooth muscles, because you know they're smooth muscles, right? Around the bronchioles become overexcitable to an antigen, some sort of allergen. Who knows what sets it off? It could be pet dander in the carpet. Who knows? But it's obstructive because of the inflammation. There's also part of inflammation is mucus. It narrows or causes bronchoconstriction. That's what makes it obstructive. It's obstructive because it makes it difficult for the air to get in. And so here's your normal healthy bronchial opening, and here's the smooth muscle, and here's a bronchiole that's undergoing asthmatic inflammation. And so you've got a lot of mucus, everything's swollen and inflamed, and now you've only got that much air space to get that air in. So that's what makes it obstructive. So the answer, you already gave it, is albuterol, which is an beta 2 adrenergic agonist. Now, it's not the only treatment, it's the rescue inhaler. I'll even put that down. The rescue inhaler is for emergencies only. So I said it before, if you have a patient come in and you're assessing them, maybe you're seeing a patient who's tested positive for COVID. All right. And so you find out their patient history, they have asthma, which is one of those underlying things that makes COVID more dangerous. And you happen to ask them, what were you taking for your asthma? Oh, I have albuterol. Anything else? No, I have albuterol. Don't let that lie there. That goes down in the chart for the doctor or PA to see, okay? Because that's insufficient treatment for their asthma. They need to be on anti-inflammatories and sometimes drugs that block the white blood cell immune response. I'm not going to get into those drugs because it gets complicated, but having the albuterol is not the only treatment for asthma. You have to be on anti-inflammatories. Okay, COPD. God, such a complicated topic. I can't possibly cover it all, so I'm just going to keep it brief. Chronic obstructive pulmonary disease. You have chronic inflammation of your bronchioles, your airways, and the alveolar tissues themselves. The narrowed airways is what makes it obstructive because it's limiting how much air can go in. You have proliferation of mucus secreting goblet cells. Those are in your, where'd my pen go? In your alveolar sacs. Okay. And because it's chronic inflammation, you get pulmonary fibrosis. So you see how things are overlapping with terms I brought up before. The mucus buildup and the narrowing of the airways is what makes it obstructive. Left untreated, remember, an obstructive lung disease is where the lung tissue is normal at first. Left untreated or insufficiently treated, it becomes permanent lung damage, and then it becomes the restrictive disorder. So COPD eventually progresses to the point where it becomes restrictive when the lungs are damaged permanently. And then we're talking serious problems. All right, so here's an inflamed bronchiole. What's another problem that we've talked about before when fluid builds up in your airways? What can happen? Because it's a warm, humid environment. Pneumonia. Bacteria come in as a secondary infection. So the primary problem is the lung disease. The secondary thing that happens is bacteria can set foot in there, and now you've got pneumonia. And then the tertiary problem is the lungs become scarred, and then you get pulmonary fibrosis left. So you see, one thing starts as one, then it becomes another, then it becomes another. So it's kind of like a pathway. All right. So this is why people come in, get a good patient history, make sure they're being treated appropriately. That's your patient history nurses, future nurses, so that you are slowing or halting the progress of the disease before it becomes permanent and lungs become scarred. Because once that's happened, damage done. Now we just have to give you supportive treatment and hope you make it, which is really comes down to that. Okay, so there's a lot going on here. Now here's where I want to actually make it bigger, if it will let me. Okay. So vocabulary, I have another slide. Dyspnea, when it has the word dysp, think disorder or abnormal. Dyspnea is when you feel like you can't breathe as well, all right? Eupnea is normal breathing. But anyway, asthma, you obviously feel like you can't breathe because your airways are narrowing. Increased resistance by bronchoconstriction that happens. Asthma may be treated with glucocorticoid drugs to inhibit inflammation, anti-inflammatories, okay? So prednisone, prednisolone, all those, okay? Being on anti-inflammatories like that have their own side effects. We've talked about that. It can shut your adrenal glands down. It causes you to swell up and things like that. Well, anyway, Singular, this is the newer treatment, blocks the action of leukotrienes, a regulatory fatty acid. Interesting, right? Related to prostaglandins. Prostaglandins cause inflammation. And so taking these things inhibits prostaglandin, which inhibits the inflammation process, all right, without having to necessarily be on glucocorticoids. So it's taking another way to decrease inflammation. By the way, since our class is primarily women, prostaglandins are what cause the inflammatory response that happens during premenstrual syndrome. All that swelling and inflammation and pain you feel, damn you prostaglandins, that's menstrual cramping, okay? All that pain, that's prostaglandins. Okay, so that maybe makes it more relatable to you. Oh, look, albuterol stimulates the beta-2 adrenergic receptors on the bronchioles to open up your airways as a rescue, okay? Emphysema, you have large alveoli, but they cannot exhale the air completely, so it's known as an air trapping disorder. And that can actually cause a lot of problems. Cigarette smoking, we're now starting to worry about vaping. Protein digesting enzymes, protease, is elevated in the lungs of people who smoke cigarettes and vape. Okay. So the only way to read this stuff is when you're online and you can make it bigger. Okay, people with emphysema, because they have the air trapping disorder, they're not getting enough oxygen. They're the ones that need supplemental oxygen. COPD, chronic inflammation, narrowing of the airways, eventual destruction of alveolar walls. So emphysema falls under the umbrella of COPD. It actually does if you look it up. Okay, and here is where this is going to make no sense to you. Functional expiratory volume. If we could have done the respiratory lab with the spirometers, you would know what that is. You can measure their lung volumes, and when it's diminished, certain lung volumes are diminished, you can then classify their disease and know how to treat them. Vast majority of people with COPD are smokers, and stopping smoking once COPD has begun does not stop its progression. So once you've done that permanent lung damage, it's kind of too late. Okay, and the rest just keeps talking about COPD. Okay. All right. Okay, we're still okay on time. So this is here just to show you a little better images of what emphysema does to your lungs. So normal alveolar sacs with the walls intact. Here the walls have been broken down. People stopping smoking early enough before the permanent damage has happened, your lungs can heal themselves. But once this has happened, they're not reforming those walls. That's permanent. And if you look at it on an X-ray, and here they've isolated it, see all that air, right? All that alveolar tissue has been destroyed. It's not coming back. That's permanent. Okay. All right. So that's what it would look like. Here's cystic fibrosis, since some of you didn't seem to know what it was. I knew one kid in high school that had it, and it does shorten your life expectancy. They're getting better at treating it, but they don't know how to stop it. So it's called obstructive. The lung tissue is healthy to start with, but eventually becomes problematic. But here's what happens. Buildup of mucus within the alveoli because of a messed up chloride ion channel. That mucus, instead of a thin film of water, is thick and viscous, and it fills some of the alveolar sacs so that when you inhale, you can't take in as much oxygen because some of the sac is being occupied by mucus. And so you're getting in less oxygen with every breath. The mucus dilutes surfactant. So now you have increased resistance to airflow. The alveolar sac is smaller because mucus is filling it up. The increased surface tension because the dilute surfactant increases pressure in the sac, and it's harder for it to expand. It loses compliance because of that. And the mucus attracts bacteria, which can lead to chronic pneumonia. And so these people this is what shortens the life expectancy of these people. The kid I knew, actually, he lived into his 30s, but he definitely had problems. They're better with treating it now. But anyway, does anyone know what this woman is doing? Because if you've seen or heard of cystic fibrosis, she has got her kid upside down, and she's basically tapping on the chest to help break up the mucus so they get expectorated out. You can also, Mucinex, right? They advertise it during cold and flu season because it breaks up the mucus that forms in your airways because of the viral attack. They have other type medications that break up this mucus in people with cystic fibrosis to help break it up so they can expectorate it, spit it out, and get it out. But it's a lifetime thing, not a seasonal thing. Oop. Okay. Got a little time. So we'll talk about lung cancer. I had a friend of mine who died of lung cancer last summer. He had been a longtime smoker, and he had quit. He had been a drinker too. He had it on all fronts. He was living a harsh life. But he stopped doing that, but unfortunately not in time. So lung cancer, there's different types. There's adenocarcinoma, which is 40% of lung cancers. Then it gets smaller, squamous cell, and then large cell carcinoma, 15%. So those are called non-small cell lung cancers. These are categories. Most of your lung cancers made up of these three, that's the majority of your lung cancer. The good thing is this is more survivable, the non-small cell lung cancers. The small cell lung cancer, smaller in frequency of all cancers, but the downside is it's usually more malignant, all right? Because it's small cell, it often goes undetected. And if someone is not going for regular x-rays or scans or whatnot, how are you going to know that small cancerous cells are forming in your lung until you start developing symptoms, difficulty breathing, coughing up blood, or a lot of mucus? And then you go, but by the time you go, it's already progressed to stage 2, 3, or 4. Mm-hmm. All right. So anyway, let's look at some of these. So the non-small cell, the most common non-small cell cancer is adenocarcinoma. So you're going to see it as nurses. 40% of all cancers, it tends to start in the mucus-making goblet cells lining your airways in your alveolar sacs. Okay. So here is the inside of an air sac, and here's the cells that are making the mucus and the fluid, and here's where the cancer is starting. All right. They have billboards. I've seen them in Florence and around where they say, if you've ever smoked in your life, go get scanned. What they're trying to promote is maybe they're trying to make a little money to get people in to come into the hospital and get scanned and everything. But really, if you've smoked a long period of time, not a bad idea, because they can tell with x-rays and CT scans of the lung field, they can pick up small points of damage and then get a biopsy and determine, is it non-cancerous or is it cancerous? If you detect, hey, I'm a proponent of early detection. That's what saved my life with breast cancer, early detection. You catch it early, like stage 0 or stage 1, that person is more likely to go on, live a long, healthy life. If you catch it stage 4 is when it's metastasized all over your body. And then you got all these little fires all over the body. How do you stop all these little fires? My friend who died, they sent him home to die because they couldn't do anything for him anymore. It was stage 4, it was everywhere. And they simply could not stop all the little fires. And that's sad. So people who smoke, they come into you, you're taking the patient history. First of all, maybe you should stop smoking, especially if they're coming with respiratory symptoms. We really need to x-ray you or do a CT scan of your lungs because you're exhibiting symptoms of respiratory distress. And you want to catch it early. I'm fine. But what if it's precancerous or early cancer cells? We can catch it and we can treat you before it progresses and spreads all over your body. You guys are going to be on the front lines. You're going to be talking to people and like, I'm fine. I really think you should do this. You got to get into the practice of that, because if you catch it early, you can save a life. Okay. Do the next one and then we'll finish the rest on Friday. Squamous cell carcinoma, cancer, second most common form of lung cancer. The squamous cells lining your bronchioles. The other one was mucus secreting cells in the alveolar sacs. This is in your airways. Okay. So think about it. If cancer forms there, in this case, it's going to be narrowing your airways, and they're going to be having a hard time getting air in. They often are linked to a history of smoking, and it tends to be a slow growing cancer. So again, if someone comes in with respiratory distress and you have a patient history of a long-term smoker, encourage them to get scanned one way or another, because if you catch it early, especially something like this, you can treat it before it becomes a problem. All right. Okay. I'll see most of you on Friday.